Hello, Namaskar. I am Dr. Neeraj Rayate. I am head of the Department of Surgery at Ruby Hall Clinic, Pune. I am expert in minimal access surgery, gastrointestinal surgery, and weight loss surgery, which is scientifically also called as bariatric surgery. What do we mean by minimal access surgery? Minimal access surgery is a new tool in the vista of surgeons which basically performs surgery without cutting opening the abdomen. So we make small holes into the patient's abdomen and we do the same surgery which is done otherwise by conventional open method. What are the advantages? Obviously, since it's not a big cut, the recovery is fast, the blood loss is minimal, and for surgeons, the magnification helps in precise dissection. One of the latest extension of application of minimal access surgery is in the science of weight loss. Conventionally, we all know that for weight loss, diet and exercise are the time-tested methods which are used. But when diet and exercise doesn't work, or when the expected weight loss is more than 30 to 40 kgs, then probably bariatric surgery or endoscopic balloon are the tools which can be really effective for the patient. When these people are not able to lose weight despite several attempts on non-surgical weight loss, we have to understand that bariatric surgery is the biggest boon which has happened to them in the recent past. We come across a lot of them who come to us, tell us that they have done diet, they have taken some powders, they have done exercise, but the weight loss is temporary. The moment you stop all these activities, it's a bounce back and you gain probably more than what you have lost. Now, these are the situations where bariatric surgery comes really for help to the patient. What do we do in bariatric surgery? It's basically a surgery which is performed by routes of minimal access or laparoscopy. We at Ruby Hall even do it by help of robotic surgery also. We reduce the size of the gastric pouch, the stomach, in which our food gets stored and digested, and sometimes we also bypass the part of the stomach and attach the distal small bowel to that part of the stomach. What does it effectively mean? It effectively means that person who has undergone this procedure, his calorie intake will go down, which we call as restriction. The hormonal effects of bariatric surgery will increase the metabolic rate of these people. The magic of bariatric surgery is to such an extent that obese people who have diabetes, who have challenges because of their excess weight and other comorbidities like blood pressure, acidity, polycystic ovarian disease, hyperlipidemia, heart disease, there are many such comorbidities which get resolved or the extent of these diseases go down significantly. We come across patients who have undergone this surgery at our hands. They come to us and tell us that it is as good as they have found a new life for them. So it is one of the surgery where you have to be hospitalized for the period of 3 to 4 days. You get ambulated on the same day of surgery. Since it is done by means of laparoscopy, there is hardly any pain or blood loss. And after the surgery, you get a new life. You go back to what you were when you were of young age. One of the effective application of minimal access surgery is coming up in a big way for various hernias. Now, hernias practically can be at the belly button, which is called as umbilical hernia, in the groin, which are called as inguinal hernia, or they can be at a previous surgical scar, which are called as ventral or incisional hernias. There can be also hernia inside the abdomen at the gastroesophageal junction, which is called as hiatus hernia. For all these types of hernias, surgical repair is very much possible these days by means of minimal access or laparoscopic surgery. Again, the same advantages of minimal blood loss, minimal pain, quick recovery are also applicable here. So patients of hernia stay in hospital for a period of 24 to 48 hours. There are nice three-dimensional effective meshes which are available to repair these hernias, even if the hernia repair is done by means of laparoscopy. So many people are not aware that hernias can be also dealt laparoscopically, wherein in fact repair of hernia laparoscopically has been a very routine for us, and it really gives advantages to patients. Other common indication of minimal access surgery is surgery for gallstone disease, which is called as laparoscopic cholecystectomy, surgery for appendicular pathology, which is called as laparoscopic appendicectomy. Besides this, almost all procedures for the abdomen are done or possible by means of laparoscopic surgery because of the 3D laparoscopy which we have. Probably the only contraindications where laparoscopy is not used these days is in pregnancy or when you have to have medical termination of pregnancy. Besides that, laparoscopy is a very useful tool for patients, and it gives very effective results with quick recovery and satisfaction to the patient. Thank you so much for listening to this video.